Hi, my name is Tay Beckel and I'm a nursing student at Minot State University, and today I wanted to talk to you about the importance of seizure teaching for teachers and school staff. Seizures can happen at any time, even with kids who do not have a history of epilepsy or seizure disorders, and it can look very scary, but it doesn't have to be, and we want you to be prepared. So I have a friend and she goes to college at Minot State University, and she was actually in class one day and they were doing presentations, and one of the students was giving a presentation and started having a seizure, and they fell to the floor, they turned purple, they started vomiting up blood, and they were shaking. And the teacher was just standing there and not doing anything. She was kind of just standing there in awe. And so my friend runs up from the back of the classroom and was like, "You call 911 and you call campus security." She turns the patient or the student on her side and kind of just took charge when the teacher didn't. And so we just want you to be prepared for if a circumstance like that happens and to make the right choices.
Let's start with the brain. Your brain cells send electrical messages to your body to tell you to move, think, and do things. But when brain cells stop working the way they are supposed to and send too many electrical signals at one time, that's called a seizure. It's like a giant electrical storm. These seizures cause a change in how you see things, how you move, and what you feel. Epilepsy is when a person, like Elena, has one or more seizures over time. Her seizures only last a short while and can look different each time. Here's how it could look when someone is having a seizure. They might stare into space. They may look like they're chewing gum, but they're not. They might be fumbling as if they lost something. They could be wandering around like they are lost. Their whole body might shake. They might say things that don't make any sense. Now that you know what seizures look like, here's what you can do to help someone having a seizure. Stay calm and try to relax. If you have a watch or a phone, try to see how long the seizure lasts. If they fall on the ground, find something soft to rest the person's head on. This protects them from hurting themselves or others. Turn the person on one side so they don't choke. Tell other people around you that this person is having a seizure. Stay with the person until they feel better and ask how you can help. Continue to be calm and cool until the person can answer questions. Be a friend when the seizure is over. If you think you aren't big enough to help, go and find an adult. But wait, there are some things you should never do when someone is having a seizure. Never put anything in the person's mouth, even medicine. Never try to hold the person down. Never leave the person lying on their back. Never make fun of someone who just had a seizure. And remember, epilepsy is an electrical problem in the brain. You can't catch it like a cold, and it doesn't make people like Elena any different from you.
Alright, now that you've watched that video, you have some ideas of what to look out for, but I just want to break it down a little more for you. So what can a seizure look like? It can be a classic symptom like they're shaking and they fall over, but it can also look like they're staring off into space or even chewing gum. So it can look like a lot of different things, and we just want you as teachers to be aware of that. Now, what to do during a seizure. First thing you want to do, you just want to stay calm. I know it can be very scary, but you want to remain with the person and try to stay calm. If they're in a desk, you want to assist them to the floor and move any harmful objects away from them, anything that they could hit their head on while shaking, anything like that. We just want to remove that from the area. You next want to place them on their side, and this is to prevent any choking. If they're vomiting or any secretions that could be in their throat, you don't want them to choke on that or swallow that. So you want to place them on their side. Next, you want to start timing the seizure. Timing the seizure is very important because if it lasts longer than 5 minutes, we want to call 911. And the paramedics will want to know how long the seizures last. The next thing you want to do is get help or call 911. You especially want to call 911 if the seizure lasts longer than 5 minutes, if it's the child's first time having a seizure, or if they do not return to their normal state after the seizure. You can also delegate these tasks to other people in the room, another student, getting a trusted adult, or calling 911. You next want to loosen any restrictive clothing around their neck. Their airway is very important, and you don't want them to choke or not be able to breathe. So if they have tight clothing on, just loosening that up around their throat. Next, what not to do during a seizure. You do not want to stick anything in their mouth, especially your fingers, because they have no control of what they're doing. They could bite down on your finger or swallow something or break their teeth if you stick something in their throat. You also do not want to restrain them. I know it can be scary, but you do not want to try and stop the seizure or restrain them because it could potentially cause more damage. Thank you for listening to this teaching on seizures. I hope to help, and hopefully this video can help you if you do need it in the future, as seizures can happen anytime, any place, and to anyone. Thank you.